So we are excited to give you an exclusive preview of a paper that we're launching. It's going to be live, I think, now. What has started as pro bono work with the IWK Foundation quickly turned into something bigger. The team that you'll hear about here, we just had a passion for women's health and wanting to see how we can make an impact and we can work with IWK Foundation to really bring to life some of the ideas. Our hope is that the paper will add to the important conversations and efforts led by so many of you here today.
As Andrea mentioned, I'm Heather Creighton. I work closely with Jennifer at the IWK Foundation. And I wanted to take a moment to say how proud we are of the work we've done with Deloitte and the report that Zahra is going to walk you through in a few moments. You've seen from Jennifer the passion that IWK has for women's health. And to make transformational change, you need a network of change makers and champions. And we found that in Deloitte. Deloitte shares our passion and vision for women's health in Canada, and a great partnership was born. And Deloitte came to the table bringing pro bono expertise, their time, their support, and their shared values. This partnership and this report will contribute to the important dialogue that we are all taking part in Canada right now. So, the Deloitte team, Elise, Jana, Zola, Mia, and Zara, who stayed on this project. Elise stayed on this project through her baby, and she has it here right now. Were you pregnant when we began? And we want to say a huge thank you. So if you'd like to come up, I'd like to present you with a little thank you and recognition.
Thank you, Heather. I think you can see what has formed between our two organizations. We just share the same values. So as by way of introduction, I'm Zahra Jivan. I'm a partner at Deloitte and focus on health system transformation. I'm also a mom of two boys, a wife, a friend, all those things that happen outside of day-to-day job. I experience the health system both from a professional as well as a personal perspective. Before I get into the paper, I wanted to share my personal story. And I would say, as all women, we all have a story to share, and I wanted to share mine. At the age of 15, I had a lump removed from my breast. At the age of 16, I had a cyst removed from my ovary. In my 20s, because of the cancer that runs in my family, I went through genetic testing, and it was discovered that I carried the BRCA gene. In my 30s, I had two boys. Before the age of 45, I had to make the difficult decision to remove both my fallopian tubes and my ovaries so that I wouldn't develop cervical cancer. What I thought was going to be just going in, doing laparoscopy should be pretty easy. I had calls scheduled the next day. I quickly realized that it's not that easy of a journey, and I was definitely not prepared. I started hormone replacement therapy the next day, and soon came all of the other symptoms. I was a new partner. I was expected to deliver. And what happened is I was focusing on weight gain. I had brain fog. I couldn't focus. I was losing hair. All the things that you would expect to come after surgical menopause. And I talked to the gynecologist that did the surgery, and her response to me was, "It's probably the hormone changes. You'll be okay." I went on to say I was not okay. I did have to do a lot of research and figuring out, what's going on with my body. I went to a naturopath because I just feel like when you go to a naturopath, they get more in depth of really looking at what's going on. The naturopath had me do blood work, and what was actually happening is that I now had an autoimmune condition. So I now have Hashimoto's. So I now have surgical menopause plus Hashimoto's, and I have spent the last 3 years navigating the health system and really trying to figure out, how do I handle both of these conditions that is not fully researched, and you can see how do you support both of those things. I share that because despite me being proactive and having access to the health system, you quickly realize that the health system is not designed for women that have complex issues. And stories like mine are the same stories of countless women. I know I'm not the only one that has developed Hashimoto's after having surgical menopause. So this paper is really important to me and to the team because we really need to change the landscape of what's happening here in Canada. And it really underscores the importance of the paper. So let's dive in. I will now get into the details. We were so happy with the design of this paper, and I just wanted to call out how amazing this looks because it is a combination. If you know Deloitte, we are all about our green dot, and we blended together the IWK Foundation branding. And it's just so emotional to see our design come to life through this. So I just want to take a moment to look at this design. As Rachel talked about, Canada's women's health strategy has not been updated since 1999. What was groundbreaking at its time was not meant to last 25 years without renewal. The current landscape has changed. There are more challenges that we know related to menopause, endometriosis, chronic conditions, autoimmune disease, none of these which was mentioned in the 1999 strategy. Women do live longer, but we spend 20% of our lives in poor health compared to men. This is not okay. I want to share some stats just to reemphasize the point, and we do share more stats in the paper. 7% of health research focuses specifically on Canada, despite women comprising 50%. So we put a little bit of a higher percentage in there compared to the 5. 75% of adverse drug reactions are experienced by women. Unmanaged menopause symptoms alone cost Canada $3.5 billion a year, with 554,000 lost workdays. And the Hologic Global Index ranks Canada 64th, well behind our peers. I also wanted to share and highlight a survey that the IWK Foundation completed with 27,000 women across the Maritimes. And we talked to the IWK Foundation of what they thought the response rate was going to be. It blew their mind of how much data they were able to capture. And if you haven't had a chance to go and read their survey, I highly recommend it. So it's a plug for the Voice of Maritime Women. But through that paper, they actually have real stories of women's experiences and the needs that they have, which is really important to help redesign what we need to have here in Canada. So there is investment in women's health. I don't want to diminish all the work that's being done with those that are in this room. That's not what the purpose of this paper is about. But I think we can all agree that there's not enough. The funding is fragmented and it has a narrow focus. It's primarily on reproductive and maternal health. And it does, we feel, as we wrote the paper, contribute to Canada's poor standing on the global stage. As Rachel also mentioned, the World Economic Forum notes that investment in women's health generates some of the highest returns. And when we looked at all of the research and all the data and we put together all of the pieces, we are ultimately not realizing the economic potential of women's health. So now I'm going to get to our recommendations, which is really the meat of our paper. So our paper highlights 3 key recommendations. The first one is to appoint a national healthcare chair, national women's healthcare chair. And the purpose of that is really we need leadership and accountability to be able to pull together provincial governments, Indigenous folks, communities all together to collaborate and co-design a women's health strategy for Canada. Our second recommendation is to develop and implement a modern women's health strategy. We need a strategy that has measurable health outcomes for women. We need to have built-in review cycles to be able to review that strategy and continue to update it. And we need to be able to identify how we're then putting back to economic and social impact. Our third recommendation is a commitment to a 10-year investment plan to support funding of initiatives across Canada and to be able to build in mechanisms where you're able to measure what the investment impact is having on the economy and women's health outcomes. The next slide, we put in here the why now. I would say there's not a why now. We probably should have had this done. But we are at a unique time here in Canada. We have the top universities worldwide. We rank between the 50th and 100th globally. We also have leading health institutions. We have highly talented and skilled workforce. And so this all uniquely positioned us to be the world stage and standing next to our peers as a leader in women's health. Technology and innovation, as we talked about and we see, is scaling at a rapid pace. And that includes both of what's happening in women's health as well as what's happening outside of women's health. For what's happening within women's health, we need to have a strategy that's going to support scalability and really be able to feel that impact across Canada. For technology that's not built for women, we need to ensure that we're not compounding the problem of creating a bias against women. So, this is the time we need to get ahead of this before we continue to compound the problem that is going to happen. Our peers have been focusing on women's health for the last few years. So, wanted to highlight Australia that created their women's health strategy in 2020, and they created a 10-year strategy, 2020 to 2030, with really a focus on the lifespan of a woman and how do you look at equity and care and accessibility across a woman's lifespan. Also, highlighting work that the UK has done in 2022, and their focus is really on supporting women's health research, creating hubs so that you're creating hubs for women to go to and have access to care across the board, and really calling for evidence and research. New Zealand has also launched their strategy, and the European Union is currently working through the launch of theirs. So we have learnings that we can take from our peers in terms of what we need to do here in Canada. So we're all part of this system, and I think we can say system change is hard. It's going to take courage, collaboration, and persistence. And we all need a common voice to be advocating for what needs to happen. I started to think through what's gonna be the mic drop at the end, and I couldn't really think of one. But what I would say is my hope for, when this conference comes together next year is we are talking about Canada's women's health strategy. And we're able to identify some initial work that's happened to start to move the dial on women's health, and hopefully for us to leapfrog where we can land on the global stage. So this is the report. This is the preview. The link will be shared after the conference so you can have a full read through of all the details on there. I just wanted to thank you. I want to give a big thank you to the team that supported writing this. And Sarah. Yeah.